When it comes to birth control methods, women have more options than ever before. However, for men, the choice is limited to condoms, withdrawal, and vasectomy. A new study published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism has established that a male birth control shot is effective at preventing pregnancy. In the most recent 40 years, contemplates have exhibited that reversible hormonal concealment of parthenogenesis, the procedure of sperm cell advancement in men, can counteract pregnancies in their female accomplices, in spite of the fact that the business improvement of the item has been slowed down. Of the 320 members who got no less than one infusion, the hormones were compelling in lessening the sperm number to under 1 million for each milliliter or less in 274 men before 24 weeks over. The male contraception shot was observed to be compelling in about 96% of proceeding with clients, with an aggregate of 4 pregnancies happening among the men's accomplices before the 16th week of the viability stage. Nonetheless, a moderately high number created symptoms, including skin breakout and disposition issue. Specialists have been exploring potential for male hormonal contraceptives for around 20 years. They have all been searching for a powerful method for stifling sperm creation without bringing on unpalatable or agonizing symptoms. Since men always create sperm, large amounts of hormones are expected to lessen levels from the typical sperm tally of more than 15 million for each milliliter to under 1 million per milliliter. Mood disorder. Researchers are still working to perfect the combination of hormonal contraceptives to reduce the risk of mild to moderate side effects, including depression and other mood disorders. It looked at men aged 18-45 who had been in monogamous relationships for at least a year and whose partners had agreed to take part. The men's sperm counts were checked at the beginning of the study, to ensure they were normal. They then had 2 hormone injections every 8 weeks, and were monitored for up to 6 months until their sperm count fell to under 1 million. They were then asked to rely on the jab, which they continued to have at the same interval, as their only form of contraception during the efficacy stage of the study, which lasted for up to a year. Once they stopped having the injections, they were monitored to see how quickly their sperm counts recovered. 8 men had not recovered their normal sperm counts a year after the study ended. The researchers stopped taking on new participants in 2011 after concerns were raised about side effects such as depression and other mood disorders, as well as muscle pain and acne. Such side effects caused 20 men to drop out of the study and were reported by many others. For this, other researchers were now looking at combining different levels of the same hormones, and different ways of delivering them, such as gels.